First of all, I'd like to say thank you to the organisers of this conference for inviting me to speak. And secondly, I'd like to say that I bring you greetings from the board and from the 20 million nurses that I represent across the world in 130 countries. I'm proud to be a nurse, I'm proud to be a midwife, and I'm proud and honoured to be president of ICN. No, I don't expect a clap, that's okay. I listened with great interest to yesterday, and I spoke with a lot of people, and I listened this morning. And I agree that empowerment is most important. But I also think that it's not, I can do so much at global level. I can represent you at global level. I can knock on doors and try to open doors. And even at that level, it's not easy. Do you think that it was easy for me to be on the Commission on NCDs for WHO? No, it wasn't. It took lobbying to get there. I'm the only nurse on that commission. Now, do you think it's easy for me to say that nurses should have a role in NCDs where they rightly should be and you should be? No, because that means I have to lobby with the people around the table to actually listen to me at breaks, in corridors, and everywhere else. And then outside, I have to get other people to lobby to have the nurses actually in that document when it came out in last September. And I'm still lobbying for you to be recognized as some of the leaders that can implement all the areas related to non-communicable diseases, and particularly you in public health. And you're going to have to find the places, and you have to go and make your own way in, or get other people to help you get in, and get your other colleagues in the medical profession, in the pharmaceutical profession, in the pharmacy area, everywhere, anywhere you can get, even civil society. It doesn't happen by chance. And I challenge you today and tomorrow, what happens next after this? What are you going to do? It's all very nice and it's great to meet and to exchange ideas. And as Barbara said yesterday, we're talking to ourselves. We love talking to ourselves. But we need to talk to others. And that was one of the messages I heard here this morning. You can do so much in relation to leadership, but you have to give voice at the end of the day. I'm one, but you're many. And if you are together as a global network, then it's up to you to make your voice heard. And let me tell you, because I'm probably not going to follow my presentation at all. This is not unusual. I'm Irish. So yesterday, I was impressed, having met the First Lady and the Minister for Health and the Minister for Education, all good people who I think believe in the right way to implement health in Kenya. And to pour more effort and to put more resources and more energy in relation to primary health care, as opposed to the way we've all gone in the Western society is pour money into hospitals. But we forget that's not what anybody wants. Is that what you want? Do you want to live till you're 100 and be dependent and to suffer from chronic diseases? No, you don't. You want, insofar as possible, to live a reasonably healthy life and not go to hospital. Okay, the nature of things is that we live, we get sick and we die. If we're lucky, very, very lucky, because it's a very small percentage, and sometimes it's Ethiopia to think that we're all going to live till 100 very healthy. That's definitely Ethiopia. Or, not Ethiopia, that's Utopia. Sorry, I didn't mean Ethiopia, I meant utopia. Apologies. So, you that are in the whole area where you have more information about community, more information about the health of the population, you are the ones that work with families, you're the ones that work in schools, you're the ones that work in elderly care, you're the ones that cross every spectre of health and family and life. So how are you going to influence your politicians? Yesterday, your politicians made quite a number of commitments in relation to investing in primary health care, investing in clinics, investing in the workforce. So what are you going to do? Are you going to follow that up, or are you just going to forget about it? Because believe you me, they mean well, politicians, but they have other people lobbying them. So when they walk out the door, what happens? They go to government, and the first thing that will happen when the Minister of Health says, I want more money, the Minister of Finance will say, no, we're pouring money into healthcare, and what's happening? The Minister for Transport will say, we need better transport. The Minister for IT will say, we need better IT, because otherwise we won't build the economy. We need to build industry. So there's a fight between ministers about who gets the most money. But let me tell you this, and I'll make no apologies for it, that unless you have healthy people going to work, earning a living, educating their children, you'll have no economy. It's as simple as that. So when people fight about money across departments, you have to help your ministers to understand that the most important thing in any government is to keep people healthy for as long as possible. And the other thing that I'm going to say to you is, how do you do that? Well, I was in Korea recently, and there was the president of the association there. They were launching Nursing Now, and they had 6,000 in the stadium. Nobody knew what was happening in relation to whether politicians were coming or whether they weren't. Anyway, what we discovered later was that she had invited all the senators, 50 of them, to come, and she would allow them 1 minute to talk to the 7,000, 6,000, 7,000 nurses. Because, of course, at some stage, they will be looking for votes. So 50 of them came. But she went up and gave her presentation first as to what she wanted. And then she allowed each of the 50 of them a minute. And following that, I was at dinner that night with her. She was ringing every single one of them to tell them, thank you, and I'm glad you made a commitment to X. So what I'm saying to you today is, if I were you, I would follow up on yesterday. And I would write to the Minister and to the First Lady and say, thank you for coming. We were delighted you could take time. But we'd like now for you to follow up on X, Y, and Z. And you may have to do that once, twice, 3 times, 10 times, because that's the way it works. Do you think that a chief nurse arrived in WHO by accident? No. Before Dr. Tedros took up position, ICN wrote to the 3 candidates and said, we need a chief nurse, we need resources for nursing and midwifery in WHO. And when Dr. Tedros was appointed, we reminded him. Because that's how things work. And the second thing that you do is you get together with any colleagues you can like we're working with nursing now. And we lobby with nursing now. And we lobby with our health professionals because there's a workforce, there's a World Health Professions Alliance, which includes the medical profession, the pharmaceutical profession, the physiotherapists, the dentists, all of those. We work with ICN. I will work with anybody that I think will make a difference to the way healthcare is delivered and the input that nurses and midwives have in the way it's delivered. But I challenge you to do the same. So following this conference, what your resolutions should be is action. And now maybe I'd better go on to a little bit more of what I was supposed to do. Anyway, just to say a little bit about ICN. It's 120 years old, and we celebrate that in Singapore this year. It's probably the oldest and largest profession in the world. And our mission and ethos is very much the same today as it was many years ago. You can read this for yourself. I'm not going to read it for you, but basically, let me say that it's about global influence at WHO, at the United Nations, at ILO, with other organizations like the NCD Alliance, like Women Deliver, any other organizations that we think will help influence our mission. The second thing that we're involved in, as has already been said, is leadership. We need good leaders. We need young leaders. And I met some of your students yesterday. And if you encourage them, Kenya's in safe hands. Very articulate young people. And what I was nicely surprised at is there were more men in the profession that I saw yesterday than women. Across the world, it's about between 10, 15, and 20%. But here I gather it's quite a little bit more. I don't know whether I was right in hearing that it's about 60-40. But if it is, that's excellent, because we want more men in nursing. And the third thing we do is socioeconomic welfare, because we believe, and I believe firmly, that if you look after your nurses, and if nurses are comfortable and safe and supported and resourced and paid in work, then you will have better health care for people. Because you have to have happy nurses to have happy patients. It's very simple. I'm going to go through some of these fairly fast, and I'm going to be told when I have time up, because I'm a devil for going over time. When we do out position statements, we do them out for the global agencies, and we also do them out for you to use at local level as well. But they don't come simply. We don't just, go into a room and write them up. So we look for the best evidence. We get the best researchers. We invite our national nurses associations to contribute. And then we analyze the data and put it together. And then we give it back out to the national nurses associations for their comments. And then when we're really satisfied with it, that it is what it should be, and that it is the best evidence across the world, then we use it in relation to influencing at global level or to provide it to our countries. This, I said before, global impact, because this is our new strategy, and it has 4 things: global impact, membership empowerment, and that's very important. And it's one thing that I would like to say something about, because I think if anything, I suppose upsets me more than anything is the fact that nurses don't work together. And I find that we do it more at global level than we do at local level or national level. And there is strength in working together. You can achieve so much more by working together. You look at countries that have achieved a lot for their nursing people, and you will find very strong associations. I would encourage you here, your countries, and in Kenya to do that. And strategic leadership, and that's been said this morning, it's so important. It's so important to encourage. I don't think that we're trained actually in strategic leadership, and I mean by policy, influence of policy. We're not trained in that. It doesn't come easy to us. But it should be started very early with our young nurses. And I remember years ago when I was a teacher, and teaching wasn't exactly my forte, but anyway, what I did was I used to bring the students to the government to see how things operated. I didn't know why, but I thought it was a good idea. I also took them round to see the CEO, the finance guy in the hospital, and all of those, because I thought these are important people in the hospital, you should know them. So I do believe that leadership is extremely important, but we have to develop the young. This is Dr. Tedros, and I am handing him our IND resource guide for 2019. We developed 3 different resource guides in 2017, 2018, and 2019. The first one in 2017 was collecting case histories. And I've been so impressed by the case histories we have got. And that was to do with the case histories in relation to SDGs. The second in 2018 was Nurses, a Voice to Lead, Health is a Human Right. And I just want to say something about human right. We advocate for patients, and we advocate very well for patients. But do we advocate for ourselves? Because to my mind, health is a human right for us too. And if we're talking about looking for support, resources, decent conditions, protection against violence, that is a right. That is health, and that is a human right. But what you see is nurses and midwives going off, stressed, upset, depressed, and with physical injuries and medical conditions. So I say, health is a human right for us too. But just to say a word about Dr. Tedros, he is an advocate of nurses and midwives, probably the best advocate I have ever met, because he has seen what has happened in Ethiopia and how nurses have made a huge difference in that country. So he does believe that we can implement universal healthcare. He does believe that we can implement the SDGs and that we can make a difference into the growing epidemic of NCDs. And you heard yesterday about the new resolution in relation to primary healthcare in Astana, and that is huge on the list. It will be difficult changing the model of care from hospital to community, but I think you have a role to play there. We cannot survive with the way our health systems are going. We cannot keep plugging money into the end years of life. And you will see that people who have insurance and in high income countries are paying huge money for a couple of years towards the end. Is that a good idea? Do I want investigations and operations when I'm 90? I don't. I'm sorry, I don't. So it's time to start challenging our health systems and what we're offering to people. I spoke to you about this. It's the NCD Commission, and the report came out, and that's the chief nurse and Howard, our CEO. Love this one because it's the only time I will be meeting royalty. And you can see it's Kate Middleton. But the reason I have this up, and you heard enough about nursing now, so I'm going to say nothing about nursing now, except that we're glad to be partners with Nursing Now and with WHO. And it's been a great, great campaign. We will take it over in the end of 2020, in 2021. Oh, sorry, wrong one. You heard about this, so I'm not going to say very much about this. It's the year of the nurse and the midwife. And of course, you have to lobby for that too. It was a great idea, and that's hard making a statement at the executive in February in relation to the year of the nurse and the midwife. I think it'll be a great year, but I expect every country. I have 10 minutes? Okay, that's okay. I can do 10. And these are some of the things that are happening. But that's only some of the things that are happening in 2020. And I was in Turkey recently, and one thing I didn't realize is that they have a museum in Turkey in relation to Florence Nightingale, because she spent her time in the Crimea War, so she was looking after the British soldiers. And so the museum is absolutely really nice because it's her room, her bedroom, and where she worked. But what I found most interesting was that she had 38 other nurses with her. And so I said, do we know the names of the other nurses that were with her? And we didn't, and they didn't. And so, by accident, I was talking to a colleague at home on Saturday, and they said, we think it's the Sisters of Charity, and some of them came from Ireland. So now I have to investigate that. Because sometimes it's, you know, one person gets the kudos for what a lot of people put effort into. And I'm sure a lot of those 38 nurses had a great contributing factor to what happened in the Crimea War. The global health challenges, I don't think I'm going to say so much about that because we have 10 minutes and you know enough about that already, and the challenges are enormous. It's amazing that NCDs has taken over from infectious diseases. Amazing that that has happened. And it's so preventable because it's our lifestyle. And you say, and I'm going to say this to you because I always tell stories, that one person can't make a difference. You think about that little girl in Sweden, Greta Thunberg, that talked about climate change. Do you know about her? I mean, that was one little girl that sat out at the government department and said, this is my world. I want to change the climate for my future, and I think you should be doing something too. And last year, if you saw, all over the world, students walked out. And I listened to some of those students speaking. I listened to them at home in Ireland. They were the most articulate people about climate change I've ever heard in my life. And those are the people we should be encouraging. So when you say one person can't make a difference, yes, they can. So there's lots of things. The other thing that, you know, is a major issue, and I'm sure you see it, and that's about the movement of people. And the actual, because of all the wars and everything else like that, that's putting a huge burden on countries that can ill afford it. I see it in Jordan, I see it in the Lebanon, I see it in countries here in Africa. Huge extra burden on people, and I'm sure you will see that as well. And conflict and war and what people have to go through. It really upset me about Sri Lanka. And it's not just what happened in Sri Lanka, but what people don't understand is that the medical profession, and particularly probably nurses and midwives, they face trauma that they've never ever faced in their lives before. But not alone that, because we called them in the association in Sri Lanka, some of their relatives had died, but they were still working. Universal health coverage? Well, of course, if we get universal health coverage, it'll lift everybody. You can read that for yourself. Grow communities, protect against disease, women economics, that'll improve, and equality. We do things well. We can do things as well as our medical professionals if we're given the opportunity. You can see that. We can prescribe, we can diagnose, because there aren't enough medics, there's not enough nurses, there's not enough. So things have to change. And you will see in advanced practice all over the world. You will see people doing things that had never been done before and doing it very, very well, economically, cost effectively, and with good satisfaction, and probably equal or better care. Two things I'm going to say, because we collected so many case histories. How many minutes have I left? 5, okay, I can do 5. The case histories we collected, and I'm sure that there's lots here in Kenya as well. And a lot of people spoke about the fact that, you know, the people in the rural areas, the people that are most in need, the indigenous population, all of those are lacking healthcare. And probably the only person that they will see is a nurse or a midwife. And what I'm seeing from the countries and from the case histories that we collect is the different models of care that nurses are creating, just so that they can get to these people and that they can deliver care. But the issue is that they're not talking about it. Only that we collected these case histories, we wouldn't know. So there you have somebody in rural Australia going out and providing care in a primary health care setting. And so much care. I'll tell you a very quick story about somebody in, I think it was Malawi, I'm not sure. And the problem is that you don't realize how important these things are. They had a lot of cases of TB. And the problem was that the people were coughing. So they were going to the pharmacy for a cough mixture. And this young nurse decided that he would take things into his own hands, and he went to the pharmacist and he said, look, you're giving out cough mixtures on a regular basis, 2 and 3 weeks, 4 weeks, whatever. Can you please, if they come for a week or 10 days, send them to the clinic? And then he went out to the communities and he talked to people about the importance of coming and being tested. Simple, very simple. Stroke action, I'm not going to say anything about that, but there are huge, huge positive case histories out there that nurses are doing and saying nothing about. Now, question for you. If you wanted to find the biggest population to bring a facility to assess their health care, where would you go? Anybody? Where would you go to find the most people? Where? The supermarkets. The supermarkets. The nurses in America in fairly rural areas went to Walmart to set up clinics. Do you know how many people go through Walmart every week? 140 million. Do you know how much they can save? 44 billion. Think about it. So nurses can improve healthcare if they lead the way. But I have one last story to tell you. Have I time for one last story? I have. This is an important one. I was in a country in Eastern Europe last year, and I was being interviewed by a journalist. And I was having a chat with this journalist. And she said to me, you know, she said, we're having difficulties here. I won't say what country it was. And she said, the nurses need a lot more resources, they need more staff, and they're not getting well paid. And she said, why is it, she said, that when doctors ask, with no disrespect to the doctors, because I have very good friends doctors, when they ask for resources, more money, they get it. She said it, I didn't. And she said, why is it that when nurses ask, they're ignored? And I was thinking, because I hadn't thought about this before, and I said, well, maybe it's, because we're mainly female dominated and we don't think about ourselves, we think about the patients, and we're always advocating for the patients. Maybe it's because we have so many other things on board. We have families, we have parents, we have all sorts of things. Maybe it's because we're too busy. And then I said, no, I'm wrong. I'm absolutely wrong. The reason why is that if you ask anybody, if you ask the general public, what does a doctor do? They will say he saves lives or she saves lives. If you ask what a nurse does, they will say, oh, she cares for patients, she gives out medications, she gets your meals, or they're not quite sure. They know that they're nice and they care. They never ever say, nurses save lives. Yet if I go into hospital, I want a good physician. I definitely do. I want a good surgeon. Definitely I do. But I want a good, competent nurse too, because if the nurse doesn't see that I'm hemorrhaging, that I'm obstructing, that I'm getting infection, that I'm getting increased intracranial pressure, at the very least I will have a long stay in hospital, and at the very worst I will die. That crosses every area of healthcare. Nurses every day save lives. So when you ask for more resources, when you ask for more money, when you ask for anything, do not apologize. Every day you're saving lives. Thank you.